In this video, you will learn important measures to monitor your baby's growth and health while in the hospital. This family integrated care system has been developed to ensure you have the knowledge to be highly involved in your baby's care while in the hospital. It can be stressful when your baby is in the hospital, but learning how to monitor your baby through a few simple measures will help you and the doctors provide the best care for your baby and give you the ability to monitor their progress every step of the way. In this video, you will learn how to weigh your baby, track your baby's feeding, and monitor your baby for danger signs. Weighing your baby. A baby's weight shows us important information regarding the health of the baby. So you will learn how to properly weigh and track your baby's weight. It's important to note that in the first week of life, all babies will lose some weight, but usually after the first week, babies should begin to gain weight again. Weigh your baby every morning. The baby should not have any clothes or blanket on during weighing, as this will provide an inaccurate measurement. The baby can be covered again immediately after weighing.
Record your baby's weight each day on the form provided to track the baby's weight gain or loss. Remember to weigh your baby every morning in the hospital.
Track your baby's feeding.
A baby's nutrition is very important for the health and growth of your baby. Breast milk is the best food for newborn babies. Your baby needs to attach deeply to your breast. Touch your baby's upper lip with your nipple. This will make him open his mouth wide, then bring him towards you so he takes the whole breast, not just the nipple. You will know if your baby is feeding well if you hear him suck and swallow.
Not every baby can breastfeed when they are in the hospital, so alternately the baby can be fed breast milk by a cup or tube. The medical staff will inform you of the best method for your specific child. Your baby should be fed every 2 to 3 hours, totaling 8 to 12 feeding times each day.
You need to mark every time you try to feed your baby every day in the hospital. Each time your baby feeds, put a check mark if it is a good feed and the baby does not vomit after. If the baby does not feed well or vomits after the feed, put an X. Giving this form to your baby's doctor and nurse every day informs the medical staff on exactly how much your baby is eating.
Monitor your baby for danger signs. Besides tracking your baby's weight and feeding, it's important to observe your baby's behavior to detect any danger signs that your baby might be getting sicker.
You will learn how to watch for 5 danger signs: abnormal temperature, trouble breathing, decreased energy levels, convulsions, and umbilical bell bottom infection. While you are in the hospital, you need to assess these danger signs every morning and every night. It is important to do this every day. Giving this information to your baby's doctor and nurse every day informs the medical staff if your child is getting better or sicker. If a danger sign is present, tell a nurse or doctor, but do not administer treatment yourself.
Now let's learn exactly how to know if your baby is demonstrating any of these danger signs. Abnormal temperature.
Your baby will wear a sticker that measures their temperature. If your baby has a normal temperature, the sticker will be dark green. If your baby is too hot, the sticker will become blue. If your baby is too hot, remove any blankets or hats. If your baby is too cold, the sticker will be pale green, red, or black. If your baby is too cold, wrap your baby or place your baby directly on your bare chest. Every morning and every night, Observe the sticker indicating your baby's temperature and circle the color on the form that matches the color of your baby's sticker.
Trouble breathing. A baby who has difficulty breathing may breathe faster than usual or make a funny sound when breathing. Often the stomach is drawn inside beneath the ribs, or the baby stops breathing for a brief period. Every morning and every night, indicate on the provided form whether your baby shows any signs of troubled breathing. If the baby had trouble breathing, you will make an X. If the baby is breathing normal, you will put a check mark.
If your baby has trouble breathing, tell a nurse. Do not administer treatment by yourself.
Decreased energy level. A baby that has a decreased energy level will not respond to your touch as usual. The baby will only move when you really try to stimulate it, or the baby does not move at all. Every morning and every night, indicate on the provided form whether your baby shows any signs of a decreased energy level. If the baby demonstrates signs of a decreased energy level, you will mark an X. If the baby has a good energy level, you will put a check mark. Convulsions. A baby that has convulsions will perform a repeated jerky movements of the arms or legs that cannot be stopped by gently holding the arms or legs. The baby may also become stiff or not responsive during a convulsion. Every morning and every night, indicate on the provided form whether your baby shows any signs of convulsions. If the baby has had convulsions, you will make an X.
Tell a nurse. Do not administer treatment by yourself.
If the baby has not had any convulsions, you will put a check mark. Umbilical infection. A baby with an umbilical infection has redness on the skin around the cord stump, or may even have pus or blood coming from the cord stump. Every morning and every night, indicate on the provided form whether your baby shows any signs of an umbilical infection. If the umbilicus looks infected, you will make an X. If the umbilicus does not look infected, you will put a check mark.
You now have learned how to effectively monitor your baby's health by weighing, feeding, and observing your baby for danger signs. You should monitor your baby every day in the hospital. Notify a nurse or doctor if a danger sign is present or if the baby is not feeding well. The information you collect about your baby's health will help you and the medical team provide the best care for your baby. It will also help your baby's doctor decide when your baby is ready to go home. It is important not to leave the hospital before being discharged. Please watch this video again or ask your doctor or nurse if you have any questions regarding this information. And you can practice these new skills with other mothers whose babies are also hospitalized.